Okay, we're ready to get started. Good afternoon, everyone. My name is Michael Prees. I'm like today's speaker. I'm from the economics department. I also serve as Associate Dean for Social Sciences. It's my pleasure to welcome you to this week's presentation in the Ahead of the Game football season lecture series sponsored by the College of Arts and Letters. Over the course of the semester, we have heard from faculty members in the college speaking on a range of topics, from video gamers as researchers to surprising artifacts from Notre Dame's history hiding in plain sight, to immigration and the natural environment in the Caribbean. Before I introduce today's speaker, I'd like to thank a few folks. I'd like to thank our friends in the Department of Music and the program in Sacred Music for allowing us to use this recital hall. I'd also like to give special thanks to Becky Badger, who Senior Administrative Coordinator in the Office of the Dean of the College of Arts and Letters, who's worked really hard with our speakers, the Arts and Letters Communication Office, and many others to make this series happen. And now to introduce today's speaker, Kasey Buckles is Professor of Economics, a faculty affiliate of the Wilson Sheehan Lab for Economic Opportunities, and a research associate with the National Bureau of Economic Research. Her research interests include the economics of the family, economic demography, and child health and well-being. Professor Buckles is the author or co-author of many articles in economics and childbirth, and on economics and childbirth, and her talk today draws from that work. Please join me in welcoming Kasey Buckles.
Thank you, Mike, and thanks everybody for being here. I know this is one of those days when it would have been a really tempting offer to just stay inside and not venture out and hear a lecture, an academic lecture on a Football Friday, but you're here and I am really grateful and excited to talk to you about something I've been thinking about for quite a while, which is the economics of fertility and specifically baby booms and busts. So before I get into my research topic for the day, I want to start off with one of the reasons why I said yes to doing this talk. So in addition to just having the honor of talking to you fine folks today, I have been increasingly looking for every opportunity that I can find to try to talk to audiences outside of economics about what it is that economists actually do, right? So some of you may have in fact been intrigued by the fact that the title of this talk is The Economics of Baby Booms and Busts, if you didn't know that this is something that economists might be concerned about, right? Part of the reason why I am really interested in drawing more folks into economics, talking about what economics is because in addition to the things that Mike mentioned, I am involved in the Committee on the Status of Women in the Economics Profession, one of our national organizations. And we are constantly confronting the fact that we have, let me get my clicker to work here, in economics, quite significant gender imbalance. So this picture here shows the fraction of senior economics majors over time who are women, right? And you can see that if you look at majors within PhD programs, institutions with PhD programs like we are here at Notre Dame, there was a little bit of increase in the late 2000s, but that's kind of flattened out at around about 1/3 women. That's very close to what we have here at Notre Dame. Our major is about 1/3 women. And this gender gap persists at all levels of the profession: assistant professors, associates, full professors, graduate students. So I've been thinking a lot about why this is with some colleagues from around the country. You know, one thing I've become increasingly convinced about is that we have a public perception problem in that people really don't know or understand the full breadth of what it is that economists study, right? And it's not just me that thinks like this. No less than Nobel laureate Esther Duflo has been quoted as talking about this issue. Esther is only the second woman to win a Nobel Prize in economics and the youngest person ever to do it. In an interview recently, she said that she thinks that the reason why there are fewer women and also why other groups are underrepresented in economics has to do in part with the fact that people think that economics is kind of useless. That's harsh, but fair maybe. Or they have a misconception that it only deals with things like interest rates, growth rates, finance, and maybe women are not so interested in that, right? And of course, economists are interested in finance and interest rates. My colleague Mike Prees, these are the kinds of things that he studies, all right? but it's not the full understanding of what it is that we do. Now, we could have a whole nother lecture on a different day about why it might be that girls and women are less interested in topics like finance and interest rates and growth rates. But if we take for a moment that they do, right, we see messages very early on that reinforce this idea that economics is about money. So this is a picture from my daughter's 4th grade textbook, social studies textbook, where they devote 2 pages to the subject of economics. And you can see the pictures are money. So we have coins, we have a piggy bank with a girl and her father counting out money, and then down here we have someone working in a factory. All right, so this is really hammering home this message about what economics is. You know, in the definition, they say something a little more broad, which is it's the way that people use resources to meet their needs. So I think that's getting closer to it, but you know, the pictures of the coins are really leave an impression. My daughter in 2nd grade had a teacher who I should say is a wonderful teacher, but in their very brief introduction to the topic of economics, she asked the class, "What do economists study?" And my daughter, thinking she had a real leg up in being able to answer this question, raised her hand and said, "Families," right? Knowing what I talk about, what I study in my own research. Now, I acknowledge that that is a very incomplete answer in terms of what economists study, but a partially correct one. Her teacher said, no, that wasn't correct, that economists study money, okay? So today, I'm going to talk about things that are not money. I'm going to take that broader view and use a definition of economics, the one that we teach our students in our principles class. You know, this is about how people make decisions in the faces of constraints, and also thinking about the consequences of those decisions, right? So really, with this definition, all kinds of aspects of human behavior, any aspect of human behavior is ripe for thinking about with economic tools and economic framework, certainly including fertility. So this is a sort of slide summarizing some of the questions that I have taken up in my own research and with collaborators relating to the topic of the economics of fertility. You know, some things very directly, obviously related to economics, like the relationship between fertility and the business cycle. You know, other things about why we see differences across kids in birth order in their outcomes and how that relates to parental investments. The thing I'm going to talk about today, so to finally get back to the topic that brought you here, is this question about what's been happening to fertility in the US for the last 15 years or so, and also taking a longer view at what happened for the baby boom. So given that economists are interested in fertility, we also should try to think about, do we have anything to bring to the study of fertility? Lots of social scientists, demographers are interested in this topic. And one of the tools that we have that I think really builds on what the work of other disciplines, what people are doing in other disciplines, is modeling. So this is usually trying to develop some sort of system of mathematical equations that capture human behavior. So you might think that something like fertility is not going to be very well captured by a series of math equations. I'm going to try to show you that it can be, keeping in mind this very important qualification, which is that all models are wrong, but the question is, are they useful? Can they be used to make predictions or provide some sort of insight about the way people are making decisions in their lives? So I teach a class here at Notre Dame for our mostly senior economics majors called Economics of the Family. And in that class, we start by thinking about a model of fertility to try to get the key elements of how it is that people make decisions about how many kids to have, when to have them, and whether to have them at all. So I'm going to give you just the very basic pieces that we introduce into that model. We like to think about somebody making decisions about their family, and at its core, they're trying to choose between 2 things: having children, which is something that they think would bring them some joy, some happiness, satisfaction, or their own consumption. So the other things that they could spend their money on besides kids. So we're going to say that every person makes the choice that maximizes their own utility in the language of economics, but really that just means their well-being. They're trying to make themselves as happy as they can possibly be, as well off as they can be, given the constraints that they face, right? So they're going to face constraints in the form of a budget constraint. We only have so much money, so many resources available to us, and prices for both those consumption goods and childcare. So in my class, we might set up a problem like this, where we're asking people to maximize their utility that depends on consumption and fertility, captured by C, children, subject to their budget constraint that depends on how much income they have. This is their wages times the number of hours they work, and then what they spend money on, which are consumption goods and children, and we have prices for those things, all right? We can, and do in my class, build this out to be really, it's very flexible. So you can include things like you allow people to care about the well-being of their children or the well-being of other people, or the effect that their own fertility might have on their community or their world. So you can do a lot to build this out, but this is the basic idea. If you're math averse or think this does not really capture the way you would think about fertility, you could also do this with a picture. So this is a cartoon, the comic XKCD, where on the left here we have the SUV with the classic stick figure family, and their neighbor in the parking lot that has, instead of the children, bags of money, all right? So our model is really just capturing that people are deciding which one of these family types they want to be. Okay, so I introduced this model just so that we can now think about times in US history when people have had more children or less children. We want to be looking for things that might be changing their budget constraint, how much income they have, the prices of having children, or the prices of raising children, or perhaps their preferences over children, right? All of those things are included in this model. I'm going to start here with the mid-century baby boom, right? So here we're talking about this period, this very unique period in US history when we had very high fertility rates. And what makes it unique, I think, is shown in this figure where we take a very broad view. This is 220 years of US fertility. The measure here is the fertility rate. So you should think of this as the number of children that an average woman has in her lifetime at current fertility levels. You know, and you can see that for most of US history, we were on this kind of glide path toward lower fertility, converging somewhere around 2 children per woman, right? But that is interrupted here by the baby boom, starting sometime around the mid-1930s, when we get this very dramatic increase and then a dramatic decrease on the other side, right? So, you know, I know we've probably heard a lot, maybe too much sometimes, about the baby boom, but it really is an extreme outlier in terms of fertility trends in the US. I'm going to zoom in, and so in terms of the total fertility rate here, at the peak of the baby boom, the average woman was having close to 4 children, right? I want to zoom in on the baby boom here just a little bit so we can think about things that are happening right around this time. When people talk about the baby boom generation, you know, these start and end points are a little bit fluid, but you often get a definition that ranges from 1946 to around 1965, and that captures these years when the total fertility rate was close to 3 or above for women, right? So people born during this period of high fertility who likely have, you know, more siblings on average, those are the baby boomers. I feel compelled as a Gen Xer to show where we are here on this graph, all right? So following the baby boom to the late 1970s, early 1980s. The reason I feel compelled is because we are very often ignored. So this is from a CBS News feature where they were talking about the different generations, the silent generation, the boomers, the millennials. Gen X is completely left off of this figure. This is my fellow Gen Xer up here saying that she's standing in front of history, asking it to acknowledge me. So I see a couple of Gen Xers in the room. Anybody? So yeah, okay, very good. So in solidarity, I am recognizing our existence. But then there are the millennials that follow this generation, another very large cohort, and of course where our current Notre Dame undergraduate students are in Gen Z. Okay? When we think about the baby boom, again, we tend to focus on this cohort that had, where mothers were having around 3 children or more. But if I'm thinking about it in terms of trying to explain it, I want to argue that it's really important to try to focus on what's happening in this period, 1935 to 1957, when you're seeing the really big increase, right? So we want to try to look for explanations. What's happening right here in the mid-1930s that caused the reversal of this long-term downward trend in fertility, all right? Now, when I ask people, what do you think caused the baby boom? Any guesses as to what the number one answer is? Any suggestions? World War II, yes. That is the number one answer that you get in terms for people's explanation of the baby boom. But I think if you start to look at it this way, right, what caused something to shift in the 1930s, that becomes a less satisfying answer. We had already started to see our fertility tick up well before the U.S. joined the World War II effort in the mid-1940s, right? You do see, in fact, a little bit of a dip right here as many men were away during the war, but they come back and just sort of resume this upward trajectory that we were already on. And then furthermore, it persists for years after World War II. So it's not really clear to me what people have in mind, that there was just some sort of national exuberance that lasted for decades and manifested in many babies following World War II. So, I do think it might have, it can explain sort of what's happening around this little window here. But in terms of this overall trend, when you really look at it in terms of the timing, it's not a very satisfying explanation, right? So let's think about some other things, looking back to our model, that might explain this unusual couple of decades here. So one thing is that we know that fertility is very pro-cyclical. People tend to have more children in good economic times, and especially they tend to have fewer children in economic downturns. So I have a paper here with Steve Lugauer and then Dan Hungerman here in the Notre Dame Economics Department, where we actually show that fertility is a leading economic indicator in that people start to have fewer conceptions even before the recession begins. That's how closely fertility tends to be tied to the business cycle. So let's see what was going on with the economy during this period. So I put up the red bars here to indicate that 1935 to 1957 period that I want you to focus on. And yeah, it looks like the economy is doing really well during this window, all right? This is coming out of the Great Depression and then the World War II boom and then sustained economic growth afterward, all right? But here too, I think when you look closely at the timing, it becomes, not a fully satisfactory answer, all right? If you look over that broader picture, if we were to widen this picture out a little bit here, right, we see, for example, that the GDP growth was really high throughout the 1950s, 1960s, other periods. And so, while it's true that it was pretty good economic times, it doesn't explain what was so unique about the baby boom, the time that we were entering into the baby boom. So I think of this, and other economists think of it as sort of a strong economy was necessary for us to have the baby boom, but not sufficient. It doesn't explain why it happened when it did and why it hasn't happened in other times. A really interesting explanation that's been proposed by Martha Bailey, who's an economist at UCLA, has to do with changes in the cost of having children. So if you remember the utility function, one of the things that was in there was the price of children. And that depends not just on how much it costs to buy things like diapers and food, but also the time cost of having kids. And so this is something that she argues might have been falling over that time. So I should say, actually, Greenwood is the one who proposed this. Martha empirically investigates it. And you can see that here in this picture. They're showing the growth of a lot of different household technologies that might have affected the cost of children during this period. Let's put our red bars on there to indicate 1935 to 1957 again, right? And you can see that, yeah, during this time, it looks like, for example, refrigerators really took off. We went from about 20% of households having refrigerators to 80%. You also see increases in things like central heating, washing machines. So the story is that this lowered the cost of having children because it lowered the cost of doing the things in the household that kids require, and therefore led to the baby boom. Here too, it's a little not fully satisfactory because you see this was happening even before and continued to happen afterwards, right? So again, something that might have been important for enabling higher rates of fertility, but doesn't really capture what was happening around this time. The other piece of evidence that Martha offers that rejects this idea that electrification was the sole explanation is that the Amish also experienced the baby boom. So they didn't take advantage of any of these electrical innovations, and yet something was also operating to increase their fertility, right? So the explanation that I think goes the furthest to capturing the timing and the magnitude of the change actually comes from my academic advisor at Boston University, Claudia Olivetti, and she looks at improvements in maternal mortality and infant formula. So let me show you here what happened to maternal mortality between 1920 and 2000, and these are deaths by a range of causes that lead to mortality. Like sepsis, for example, which is an infection, toxemias, hemorrhaging, excessive blood loss, all right? So you can see that in the early part of this graph, in the 1920s and early 1930s, you have very high rates of maternal mortality. So Claudia says in the paper, 1 in 125 live births resulted in a death of the mother. When you account for the fact that women had multiple pregnancies, multiple children, the likelihood of dying in childbirth was 3 in 100. So think about 100 women that you know, 100 women that you maybe went to school with here at Notre Dame. 3 of them would have died in childbirth during their lifetime. So that certainly makes fertility very costly. And then there's also the fact that there is high rates of infant mortality during this time. What happens in exactly 1935 is the introduction of mass-market sulfa drugs that can be used to fight infections, where again, infections are one of the leading causes of death. So sepsis here, right at 1935, those deaths to mothers fall off a cliff. Blood banking was introduced in 1936, which is a treatment for some causes like hemorrhage, right? We further get the introduction of mass-market penicillin in 1943, also used to effectively fight infections. Over this period, we also see a lot of movement of births into hospitals. So all of these medical interventions combine so that in a really short period of time, this 2-decade period that we're looking at, deaths from, for example, sepsis fall by 90%, right? So this, again, dramatically reduces the cost of having children. The other piece, they frame this as medical technologies. The other technology that they talk about in their paper is the introduction of infant formula. So this was developed in the 1930s, so they don't have earlier data, but they're showing the price of infant formula over time, and it too fell really quickly after the mid-1930s. This is another significant input into children, especially if you think about the substitute for it being breastfeeding, which would have required months and months of time, kept women out of the labor force. If we now have an affordable alternative, that could reduce the cost of having kids and increase fertility. So in their paper, they argue that they can explain about half of the baby boom with these improvements in technologies, right? So this is the one that I like the best. I think it's creative, something that it sort of took economic approaches and an economic way of thinking. This is a cocktail of things, as we've seen, but this is, for me, the most salient one. Now, I do have a graduate student here at Notre Dame, Henry Downs, who is working on exploring the role of unionization, which is also something that shifted after the introduction of the Wagner Act in 1935. So his argument is that as places rapidly unionized, that introduced the prospect of higher wages, more stable wages for a lot of Americans, and also enabled higher rates of fertility. So stay tuned for his investigation of the role of unionization in the baby boom. All right. So that's the baby boom. I want to talk about something that's been the focus of a lot of my research in the last few years, which is the baby bust. So going back to our picture here, 1800 to 2020, you can see this very small, relative to the big picture, small dip in fertility in the last couple of decades, all right? So in the grand scheme of things, maybe that's not such a big change, but it has brought our total fertility rate to the lowest levels in recorded US history. So 1.64 in 2020. I should say that just a couple of months ago, we got the report for 2021, the provisional report, and it suggests that it was 1.66, so actually slightly higher in 2021 than in 2020, which we might come back to, but still historically low levels of fertility in the United States. This picture, zooming in on this 1989 to 2019 period, and I'm switching the measure here. This is not the number of kids per woman, but this is the number of births per 1,000 women, age 15 to 44. So in 2007, we had about 69 births per 1,000 women. By 2020, that was down to 56. So that was a 4% year-over-year decline and a 19% decline since 2007, right? So really big change in fertility over a short horizon. You may have seen news of this here by looking at things like New York Times, NPR, Associated Press, the coverage even abroad of our fertility decline here in the United States, and also a lot of opinion pieces, think pieces trying to speculate on the causes of this fertility decline, the consequences for families and for the US as a whole. So let's go through sort of our steps that we had with the baby boom and think about the baby bust. Just like with the baby boom, we can think about what's going on with the economy. So I already told you that fertility is pro-cyclical. And looking at the graph on the previous slide, it may have set off alarm bells for many of you because the decline starts right in 2007, which was the very beginning of the Great Recession. So, as I told you, fertility is pro-cyclical. You should have already been thinking, big recession hits, we would have expected a decline in fertility, right? And absolutely that's the case. If you look at our GDP graph here that I showed you before, 1989 to 2019, you get the decrease, the real decrease in GDP in the United States in 2008 and 2009. I'm going to show you here the unemployment rate because I think that's sort of picks up what families might be most likely to be responding to immediately. So here again, 2007 to 2020, you get the really big increase, reaching almost 10% unemployment in 2009. But then you get a precipitous decline after that, right? So fertility or unemployment rates here do start to fall as we come out of the Great Recession. So that by 2013, 2014, we're down to typical levels. There's, of course, the really big spike on the other side of this that is the COVID recession, but we're going to put that aside for the moment. Thinking about this period, right, we should have seen a decline in fertility, but it also should have rebounded in a way that it didn't. So this is what my collaborators Lucy Schmidt and Melanie Goldie and I call the babyless recovery. And this was some NPR coverage in 2019 as the numbers for the previous year came out. And so I was quoted here in NPR calling it exactly that, a babyless recovery, and talking about the fact that it hasn't bounced back the way that we expected. So it should have rebounded, but it continued to fall. We need an additional explanation for what was happening over the last 10 years or so. So thinking about what might have happened around 2010, that is the year that the Affordable Care Act was introduced, right? So let's think about why this might matter for people's fertility. There were three really important provisions to the Affordable Care Act that affected, we will argue, people's access to contraception. So these include the young adult provision, which enabled people to stay on their parents' insurance up to the age of 26. So if you think about young people having relatively high fertility rates, that might have affected that group. There's also the contraceptive mandate, which required insurance plans to include contraception in the things that they cover. And then there are the Medicaid expansions, which increase the size of the population that's covered by Medicaid to cover more low-income people. So if you look across this time period, you can see what's happened to the rates of uninsurance. And in this picture, we have isolated in our paper people that we say are at high risk for unintended births. So here we build a model, again, to try to predict pregnancy intention. But you can think of people who are unmarried or especially young as being at high risk for an unintended birth. So if we look at that population, you can see here, if you focus on this dashed line, this is the fraction of those who are at high risk of unintended birth who are uninsured. Around 2006 to 2010, these time periods are determined by our data set, which is the National Survey of Family Growth. Around the Great Recession, the peak of the Great Recession, 45% of this group is uninsured. By the end of this period, that's down to less than 30%. Right? So that's a really big increase in their access to insurance. Why might that have mattered? Because insurance coverage might provide access to contraception, and in particular, it might make it possible for people to obtain very effective methods of contraception. So here we are looking at this same population. People are at high risk for unintended births. This dotted line is showing the fraction of that population that is using what we call a long-acting reversible contraception. So these are methods like IUDs or implants that are highly effective, and once you adopt that method, they can last for a very long time until you want to reverse them. Okay? So the important thing, though, to keep in mind is that these are very effective methods, even relative to something like the pill that's also on this graph. Certainly, when you think about their real-world use, right? So the fact that it's easier to miss pills, have gaps in your contraception coverage. So we see going from, again, 2002, 2006, 15 to 20% of women in this high-risk group using a long-acting reversible contraceptive method. By the end of the period, that's closer to 30%, right? And the insurance likely mattered here because these methods often have very high upfront fixed costs. You have to go visit a doctor, get a prescription, and often pay hundreds of dollars out of pocket initially, rather than something like the pill where the costs are much more spread out over time. Right. This argument for the importance of LARCs and access to them also relies on looking at for whom fertility rates are really falling. So if I break down that picture I showed you before with the birth rates for the population, if we look at that by age group, you can see here, for example, that for teenagers, there was a 60% decline in the fertility rate between 2007 and 2019, right? This is astonishing, right? In 12 years, the teen birth rate fell by 60%, right? And it had already started to decline a little bit, but had leveled off for 4 or 5 years before 2007, and then that started a new decline. And I think most people would view this as really good news. For women 20 to 24, a 37% decline since 2007, and 25 to 29, a 21% decline, right? So when you hear people talk about fertility decline, it's really about young women having lower rates of fertility, and especially teenagers and women 20 to 24. If we go to look at who is using LARCs increasingly, it's teenagers and women 20 to 24, right? So it really does seem like over this period they have shifted contraception in a way that is leading to lower birth rates, and we argue lower rates of unintended births, right? So I'll come back to that in just a second here. The other part of unintended births, though, there's whether you have a birth conditional on having sex, but there's also are you having sex? And we're seeing that young people are having less sex and less risky sex. So this is part of a broader trend in young people engaging in fewer risky activities, whether that's drug use, risky driving, risky sex, as we have here. So this is something that social scientists across disciplines are trying to understand. But we can see that in our data, this group, again, that's at high risk for an unintended birth is having less sex over this period by about 25%. And that's mostly coming from people not having sex at all. Right? So if you get this combination of less sex and conditional on sex, more effective contraception, you get these lower rates of births. Oh, let me hold off on that. You might think about why there's less risky sex. As I said, we're still trying to understand that, but one hypothesis is that what happens in 2007 is the introduction of the iPhone. And the argument here is that, where teenagers might have gone out to parties and fields and had a lot of alcohol and engaged in risky behaviors, some of which might have led to a birth 9 months later. Increasingly, they are staying home, playing video games, they're on their phone. They might be sexting, but not having actual sex, right? So, as we think about the broader societal consequences of everybody having smartphones and social media, this may be a silver lining in that it's reducing actual risky behaviors. All right, so as I said, these two things together should have led to decreases in unintended births, and this is exactly what we see in this picture. So here in our paper, we plot the number of births that we identify as being intended and the number that we believe are unintended. You can see that over most years, these two things move really closely together. Whatever's affecting unintended birth tends to also affect intended births. That was true through the early years of the Great Recession, although intended births fell even faster, which we think makes sense because those are the people that were making conscious decisions in response to economic conditions. But in this period that we're talking about, the babyless recovery, they really diverge. So that intended births did recover, but it's unintended births that continued to plummet. All right, the dots are from a different data source, so that too, if we want to talk about the most recent 2 or 3 years, we can come back to that. But at least this really puzzling period seems to be about unintended births. All right, our number in the paper is that unintended births fell by 22% between 2007 and 2019. And I want to emphasize here that we think this is not due to increases in abortion, because abortion rates were also falling over this period. So it really seems to be a decrease in unintended pregnancies, unintended conceptions, and not a decrease in births conditional on conception. All right? If we look in a broader worldwide context, we think this helps us explain why it is that the U.S. has had higher fertility rates than a lot of comparable countries for a long time. So in this figure here, the U.S. is the green line on the top. You can compare us to other developed countries in the OECD or the European Union. We have long had fertility rates, above replacement rate of 2.0, 2.1, while these other countries have not. But more recently, we've started to converge. And what my co-authors and I argue in some ongoing work is that our rate in the US was inflated by the fact that we had so many more unintended births. And now that we're having fewer of those, we're converging to have fertility patterns that look a lot more like our economic neighbors. Okay, so in the last couple of minutes here, I want to talk about why fertility decline matters. You've likely heard concerns about things like the sustainability of Social Security and Medicare, which require current workers to support current beneficiaries. In 1960, we had 5 workers per retiree, and now it's about 2.5 and expected to continue to fall. We also need young people for growth. So, if you look at the case of Japan, a big part of why their economy has stagnated in recent years is in part due to weak demand because of years of low fertility. And we need young people to be inventing things and solving problems and being creative. So that's a concern. There are big implications for declining fertility for sectors that require people, like education and housing. So I can say for sure that there are people in higher education that are really thinking about what's going to happen as we get smaller and smaller classes of graduating seniors, for example, in the coming years. I want to emphasize here that these problems have multiple solutions that don't just require getting people to have more children again, right? Or certainly don't require trying to bring our number of unintended births back up. I don't think that's the solution that any of us would propose, right? An important piece of this could be immigration. So as I have been talking about declining fertility in the US, it is a nice coincidence that just on Tuesday of this week, we celebrated 8 Billion People Day. That was like a UN World Health Organization recognition of the fact that the US or the world population is now at 8 billion, right? So there are plenty of people in the world, and if we want to have a larger population in the US or sustain population growth, this is another option that's accessible to us. So if my main reasons for being concerned about fertility decline are quite different. I think about fertility inequality, the fact that we're seeing that increasingly families who have college graduates, who are high socioeconomic status, are continuing to have children, or in some cases even having more children than they have in the past, but families who are more disadvantaged are not. And that may be a sign that there are many people out there who would make good parents and want to be parents, but don't feel like it's accessible to them because of the costs or because of their income. So I think that is something that I am paying attention to. And then there's also this quote, "Children are the ultimate vote of confidence in the future." I described our result where we think that people decrease fertility in advance of economic recessions, and that's because fertility really captures people's confidence, how they're feeling about their future prospects and their kids' prospects. So if people are having fewer kids, and here I'm talking about the intended part, then we should be asking, what does that tell us about how they're feeling about their future prospects, economic and otherwise? All right. The one thing I want to close with here is that as somebody who stands in front of audiences and talks about fertility trends, I think it's really important to reject ideas about some births being more important than others, or indeed some people being more important than others. We saw earlier this year in Buffalo a tragic shooting where the shooter was motivated by replacement theories, concerns about some races being replaced by others. So I want to come out rejecting this. We can talk about decreasing fertility and even decreases in differences across groups without elevating ideas that some births are more desirable than others. All right. So with my conclusion here, you might think that I was going to conclude with births, but I want to come back actually just to what is economics, okay? In addition to people like me who study families, we have economics professors in our department who study all of these other things in addition to those who do Fed behavior and monetary policy, the environment, religion, poverty, innovation, migration. So this full range of the human experience that I talked about earlier. And this is a quote from Alan Krueger, who was a very well-known economist, worked at the White House for many years, who said that the point of economics is to figure out how, in a world of scarce resources, we can make people's lives better. So with that, I will finish, and if we still have time left for some questions, I'm happy to take those. Yes, go ahead.
touching on one point that you made, having grown up and being in high school and college in the 50s, it seemed to me that then people had a positive outlook about the United States, about its role, about what it could do, and that maybe encapsulated all the things you had made, the other positive things you had made about that.
Yes, I think you're exactly right? It ties into this idea at the end about fertility capturing something about how people feel about the state of the world and their own confidence. I think that is, I dismiss the idea of the long-term effects of World War II, but I do think that that could be part of it, and that it was a period of national optimism about the future and what was possible that might have played into the baby boom, the sustained fertility over the 10 to 15 years after World War II.
So like increased salaries of the middle class to that?
Yes, yeah, and so the increased salaries of the middle class, and that's where my graduate student is working on unionization, and that's kind of the angle that he's taking, that argument he's making. I saw a question in the back there first.
Your study shows that the intended pregnancies, you're assuming you can get pregnant when you want to. Are there studies showing how much people are willing to spend to get pregnant if they're unable to? From, this is from seeing friends spend thousands and thousands of dollars and time.
Yes.
Is there studies to show at what point how much people will spend to get pregnant?
Yes, so you've hit on something really important here, which is that we're modeling people's desired fertility, but there may be differences in how much they're able to achieve that. We talked about where they might be missing their desired fertility in terms of their ability to avoid undesired pregnancy, but there's also the side, can you have the children that you want to have because of fertility constraints, differences across aging, or the effect of aging on fertility. So this is something that I and others have looked at as well, and how the introduction of infertility treatments has affected how women plan their fertility and their ability to achieve their desired fertility. So if you look, if we went back to the picture, I won't flip back through, but what's happening to older women, they actually have a little bit of an increase, so that now women 30 to 34 have the highest fertility in the United States, that age group. And there have been big increases for women 40 to 44 that have been enabled by these kinds of technologies, right? So that's definitely something that is happening here. Relative to the population trends, that's still a pretty small part of what's going on in the whole, so that's why I didn't talk about it very much here, but it's something really important for that group, I agree. Yes?
Sort of related, but I keep hearing that sperm counts have been decreasing significantly. I'd be interested in a graph, overlaying a graph of historical sperm counts.
I would be so interested in that too. So this is an idea that a lot of people are thinking about, but it is very difficult to measure. We do not have population-based measures of sperm success. Because the people who come in to have it studied are typically already struggling with infertility, and so it's kind of a selected sample. So I think it's an important idea, and there are definitely medical, biological reasons to think that fecundity, which is your ability to have a baby, especially for men, might be falling, but it's something we haven't quite been able to figure out how to measure its importance yet. Yes, in the way back there?
Hi, I just wonder about the effect of some messaging that people should have fewer children, especially in the international comparisons that you drew. I'm just thinking about people like Paul Ehrlich and the population bomb and the population council, and this, it still shows up today, I think, in some rhetoric around climate change, that people should have fewer children because the Earth can't sustain. And the UN really promoted that idea, at least into the 90s, so I'm curious if that has happened.
Yes, and in fact, is still promoting this idea in countries that have relatively high fertility. There are active efforts to try to introduce family planning information and services to try to have lower fertility in places where they haven't been able to, people are maybe still having more children than they would like to have. So I think you're exactly right. The population bomb is a really interesting factor, I think, for sort of what happened coming out of the baby boom. So, my mom, a mother of a Gen Xer, talked about how there was a real emphasis on having a 2-child family, that is a way to try to control global population. So I think that we didn't talk about the reasons why we came out of it, but I think that's potentially important there. In terms of the environment, this is something you hear a lot in these think pieces, for example, on why people are having fewer children. People will say, I'm not sure it's morally responsible to bring people into a world that's warming. But I will say, if you ask people to rank those, it's actually pretty low in their reasons for not having children. What I tell people is that, if you want to have kids, the effect that they will have on global climate is very, very small marginally. And in fact, they might be people who would invent something that could help us come out of it. So it's not, if I were to make a list of 10 strategies to fight climate change, not having kids if you want them would not be on it. All right, maybe, how much time do we have, Becky? Yeah. We can keep doing it? All right, good. So maybe here on the left.
Yeah, so my question is, have you studied at all the impact of, in the last, I don't know, however many years, more women entering the workforce in professional positions as well?
Yes, so that is also hugely important for thinking about what happened since the baby boom, the rising rates of women's labor force participation. This is tricky for our economic models because we think of those two things as kind of jointly determined. It's hard to know whether the fact that women started having fewer kids enabled their labor force participation, or it was because they wanted to participate in the labor force that they had fewer kids. So it's kind of tricky to try to disentangle cause and effect there, but they're certainly related. Part of the reason why fertility generally has been falling as economies have developed is because the economic role of women has become more important. So the opportunity cost of having children has gone up because they could otherwise be participating in the labor force and earning money. Yeah, so it's definitely a part of these models, not what we showed today. And then I saw one more here.
Yeah, my question was related to what you were just saying, that I think it's hard to analyze the blips in the total fertility rate unless you really understand why it fell for 120 years before that, or why it is so low from an evolutionary point of view. When we're so rich, we should each be having 15 children.
Yes.
And so, yeah, go ahead and talk.
Yeah, so you're absolutely right? We were on this long-term decline, and this is what you see over time across countries as they industrialize, as their economies grow, as their GDPs grow, fewer children. And this has been a puzzle, right? Because exactly as you say, if you think of children as normal goods, to use the language of economics, meaning that people like them and want to have more of them, they bring value to people's lives, then you might predict that as people become richer, they would have more kids, right? But that's just not what we see across time and across countries. And a big piece of that really is this argument about, as the economy develops, what has happened alongside that is the cultural and economic roles of women have increased such that the value of their time is much higher, and that puts downward pressure on fertility. So you're trading off what we call the income effect of being richer versus the substitution effect, which is that children are now relatively more expensive because they cost women's time, which has higher value. Okay. Well, thank you so much again for coming out on this cold day. If you're going to the game tomorrow, bundle up and let's finish the season strong with a win tomorrow.